Hello and good afternoon to everyone, morning or evening, wherever you are in the world. This is truly a fascinating conversation that we're going to have. I have with me an international collaboration of clinicians who have come together through COVID-19 to try and find real solutions across the world. What is even more unique about this group of doctors and clinicians is that they have been able to communicate in multiple languages over the period of time. And so they have been sharing ideas, treatments, concepts, research in a way that I have never seen anywhere else, where we're having that kind of communication in multiple languages. And so I just want to quickly introduce everyone and get everyone to get a feel as to who these people are. Hello, everyone. I just ask you to unmute your mics. And what I'll do is very, very quickly ask everybody to do just a quick introduction of themselves. And I'll probably start with Patricia. If you could unmute your mic for me, Patricia. It's still muted. Just to tell us a little bit about yourself, just in a few seconds. Go ahead, Patricia.
Good afternoon, good morning for everyone. My name is Patricia Calisteris. I'm from Bolivia. I'm an orthopedic pediatric surgeon. I have been working with patients with COVID here in Bolivia. Thank you very much for this meeting.
Wonderful, wonderful. And Rodrigo?
Sure, thank you. My name is Rodrigo Contreras. I'm based in Canada, and I'm a government relations expert, previous government official from Mexico, and assisting doctors for the world in their communication strategy globally.
Wonderful, wonderful. And we've also got Shankara.
Hi, my name is Shankara Chetty. I'm from South Africa. I'm a natural science biologist and a general medical practitioner and a frontline worker seeing COVID.
Excellent. And we've got Raul as well.
Good morning to everyone. My name is Raul. I'm pharmacist and I'm the biochemist, COVID survivor, and now helping Doctors for the World as marketing strategist.
Wonderful. And we've also got Christiane. You're muted at the moment.
¿Puedo hablar en español? ¿Sí?
Yeah, can you just in English if you could, because most people will probably understand English.
Okay. Good morning, everyone. My name is Cristiane Matos. I am a health researcher, and I'm based in Brazil. And now I'm working with policies, public policies regarding to new innovations from the fight from COVID and other infectious disease. Thank you for
wonderful, wonderful. And last but not least, we've got Fanny here. And Rodrigo, this is part of what's most fascinating, is because Fanny will be speaking in Spanish, but Rodrigo will be translating for her. And Fanny is very, very important because she was the originator of this idea. And so, Fanny, can you tell us about what happened when you were in Italy that caused you to think about doing this?
Yes, the situation in Italy was very critical. In Milan, the epicenter in Lombardy area was very bad, fatal. We didn't know what we were going up against. I was in Piemonte working in intensive care when they called us and they communicated that they needed help because the personnel in the healthcare system, it was very little. And for us, immediately, I didn't think about it twice. I prepared my Jeep, I called in my colleagues that we need to go help them because we studied for this and we need to go. But I prepared as it was, I was going to a war. I went to the hardware store to get visors, to get equipment for military use, to paint walls. My friends started looking for masks and they started looking for everything. There wasn't anything. It's true. When I had everything prepared, I prepared mattress, footwear. I prepared as I was going to war. And in that moment, I put everything in the car. I communicated with my colleagues that I was going to go pick them up, and a lot of them said, "No, I don't want to go die away from my family and my home. I prefer to stay." So what I did, I decided to go alone. I left to my car, but first I prepared a will directed to my parents. I communicated that I loved them and that I didn't know I was going to come back. But I think the values that they gave me to serve and attend to the rest, I take them with pride. And that's how I left. All my documentation in order. I have a lot of little animals. I have cats, dogs, and different animals that I adopted. I left them with care and somebody else, and I left. And I cried all the way towards to help people, and I asked God to give me strength, protect me and my loved ones. And at that moment, a colleague called me, and she told me she was in Lombardy, and she told me, "I'm waiting for you, Fanny." I was crying, and the only thing that I told him was asking him, "What are you doing?" She was coming from Sicilia, from Napoli, and "What are you doing this? Why are you going? Why are you going after?" And she responded, "Oh, I'm like you.
Mhm.
We're a few, but we're together. Don't cry. I'm here for you. You're not alone." And that gave me the strength for me to go. And I arrived in Milan. I entered Milan. Police cars stopped me. They asked me for my documentation. I identified myself. And they asked me, "Are you going to the hospital?" "Yes, I'm going there direct." They said hi. They saluted me as a military salute, and they thanked me. "Thank you. Thank you. We need this help. Our people are dying."
Wow.
They accompanied me to the hospital. They escorted me to the hospital. A psychologist received me, and the personnel received me, and they said, "Are you looking at the situation? We want to know if you want to continue or you want to go back. And you need to sign who we're going to call of your family members if anything happens to you." I gave my Peru phone number because I'm originally from Peru. And they said, "Prepare yourself and prepare them." And
Wow.
I entered, and the colleagues, they said hi. And they asked me where I was from. I said, "Piemonte." And in a dialect that every region has in Italy, Urca, they said hi in Piemonte dialect, and they give me a hug. They said hi, and they said, "Thank you for giving us help." And they prepared me, and I entered.
And so, Rodrigo, what was the In what was the driver for Fanny to then take this into founding Doctors for the World? This was clearly something that meant so much to her. What made her then take that next step to take on trying to create a group where doctors could collaborate across the world?
Well, this is the motivation that pushed her to generate Doctors for the World, of not knowing there wasn't any communication. Why weren't we prepared? My father died because of COVID.
Okay.
And I said, hi, I gave him a call. I was in the hospital when I called him, and his words were, he said, I love you, that he was sick, and he knew that he wasn't going to be able to leave the hospital, and he's told me, I helped as many people as I could. Neighbors are dying, but I know you're going to help people. You're going to work with doctors, and please focus on helping.
Wow.
And I didn't doubt it. I didn't want to let him down.
Mm-hmm.
He died, and at that moment, he left me. I had a telephone relationship with many people from Peru calling me, asking, and people were dying. We didn't have any medicine. They didn't have anything in Peru. There wasn't any oxygen. It was a desperation, total desperation, total. The hospitals were not enough. They didn't have any money to take. People didn't have any money to take care of their loved ones. They were auto-medicating themselves, and that desperation, because she was called from morning till night, different time zones.
Mm-hmm.
I had the phone active 24/7. That desperation was the purpose that I established contact with home therapies with the lawyer Eric Grimaldi. I asked him for help, and I asked him for doctors that could help the situation in my country and in different parts. And we started. He sent me doctors and colleagues that helped me with this effort. And we started organizing ourselves with municipalities in Peru. We started with Peru because the municipalities were very desperate. They didn't know what to do. The doctors didn't know what to do. They needed help, and they didn't know which were some ways that in Italy were helping to treat people. So they organized virtual calls with their doctors in which we can communicate what we were doing in Italy. And it was 24/7 interaction with patients, medical doctors, and medicals in every specialty, every healthcare worker that we can get our hands on help in this communication.
Wow. I mean, that is the most riveting story. I am so privileged to hear that. That is an incredibly inspiring beginning to what could turn out to be a tremendous movement of clinicians across the world. And we will have to thank that inspiration that Fanny got. I'm really sorry about your dad, but if there is one gift he has given the world, is the ability for doctors all over the world to come together and start trying to find real solutions for health problems. And in that line, Rodrigo, I'm going to ask you, how did you get involved with regards to this? I'm sure Fanny was reaching out to people. How did you get involved, Rodrigo?
Well, thank you, Dr. McMillan. And yes, well, I started participating with Doctors for the World. Another actually colleague from Canada connected me to Fanny. And just a little bit of my background, I'm not a healthcare professional myself, but I'm a government official. I've been a government official for more than 20 years in the country of Mexico. And I've been assigned to different countries, including Canada, which I decided to live in Canada in the last, even before the pandemic. So Fanny invited us, and basically they brought us in to try to organize the right messages, or to give it an organization that will be able to communicate these messages not only to doctors, but other World Health Organizations. So as you know, unfortunately, sometimes, and in this situation, health does have a political element that we need to be careful of. And at the end of the day, in order for the doctors that take part in Doctors for the World to really have a positive result, we need to keep the perception of the group in order and with the focus of assisting more people. So basically, I was brought in to assist Fanny in this effort, and it has been very, of course, fulfilling, trying to help out. One of the first things that we tried to do is Fanny already had a team of professional translators assisting them doing continuous translation. So we had very, very long sessions, I would say 4 to 5 hour sessions with different doctors. And one of the things we wanted to do is make it a little bit more efficient, more digestible. And we brought in, of course, through the assistance of technology, now we have in our platform simultaneous translation in different languages.
Yes, and very similar to what you've just done with Fanny a while ago, which works very efficiently.
Yes. So with that said, now I believe Doctors for the World is a platform that allows different doctors to listen to treatments, to listen to experiences, to understand in which countries there is certain political support to their efforts, and try to replicate the efforts within their countries. So I think that is a very valuable tool that Doctors for the World is bringing to the global medical community.
Excellent. And you've got Raul as well, and Raul is in Mexico. You're muted at the moment, Raul. But in terms of your involvement, Raul, when did you get involved? I mean, clearly Fanny was doing an incredible job of pulling people into this vision that she had. How did you get involved?
Yeah, I'm a pharmacist with specialty in biochemistry, and I've had the opportunity to work in private and public clinical laboratories, and also in pharma laboratories, sales and marketing and so on. And last but not least, I've been working with several universities in Mexico, trying to stress or to give the importance regarding the non-transmissible chronic diseases. So during all this time, up to February of 2020, I was invited to help to understand some other colleagues here in Mexico and Latin America regarding this chlorine dioxide solution, all together with Comusaf Americas. On December of last year, I got SARS-CoV-2 from the mother of one of my students. And so I was in very good shape. Finally, I managed to get out of this disease. And so in March, I was invited by Patrick Calisperis to join them in a summit. And then I realized that I had to make a change, and that At the moment, I'm not very well of health. My lungs do not work as they used to. Then I realized that I had to leave a legacy, not only with my studies, but also with physicians and allied professionals. So that's my story. I think I need to live a life at a day so that I can share as much as I can when I'm still alive.
Oh, wow, that's tremendous, Raul, and this is what's most fascinating about this group of clinicians, is that everybody is motivated to make a difference. And I was just thinking about Christiane from Brazil, as to how you got involved, Christiane, and what was it that that motivated you in this situation. You're muted at the moment, by the way.
Thank you. I will try to speak in English, but I don't know if I will be good. So I have an academic formation in infectious disease. So naturally, I'm a researcher. And since last years, we are trying to get here in Brazil some researchers regarding chlorine dioxide and this effective for COVID and other disease. And we still are trying to do that here. So we are involved in specifically, I am involved in many initiatives regarding this. And now I receive the invitation directly from Raul Pineda and after from Dr. Fanny, who I have really to say thank you very much, Fanny, because your history have inspired many of us to do that.
Yeah.
And thank you too very much for my two colleagues that we are working from many times together. That is Dr. Patricia Calisperis. Thank you for working with you, and Raul. So also that's two special people. So here from Brazil, I am totally in favor to join efforts to fight against this pandemic and other ones that we can fight.
Wonderful, wonderful. I really appreciate that, Christiane. And as we think about some of the other things, I mean, we've got Shankara here. I've spoken to Shankara many times on LinkedIn, and Shankara is also involved in this effort. And just to share your experience of what you have seen, Shankara, because you've recently been involved in this. What are your thoughts?
Philip, how I came to be with Doctors for the World. When COVID came to South Africa, my aim was to try and see my patients physically, understand the illness. Doctors were seeing patients in hospital, and I felt that we were missing out on a lot of information there. And so I took the risk of isolating myself and physically seeing every patient that walked in my door. I set a tent outside and I tried to figure this illness out. And I have a natural science and biology background. And so very quickly, I realized that we're dealing with a biphasic illness. I modified my treatment accordingly. And I started to see very quickly the benefits of what I had found. But where I found a lot of difficulty was to communicate this to the world. This kind of information was worth nothing in my hands. And so I wrote out a paper without intention of publishing it, but spread it to every hospital, every doctor I could think of. And I still had no traction. Eventually, it was picked up by a journal and published. However, I needed to get this word out and to help doctors save these lives. These are my patients. I was getting calls from people far and wide I couldn't stomach the helplessness and the hopelessness. So I had to take this risk. Subsequently, I looked at the pushback I was getting. At the time, I was very controversial. And with the pushback that I was getting, I noticed that there were a lot of different agendas out there, from government to pharmaceuticals, political agendas. So I had to find a way to circumvent all these agendas. The bottom line was that I needed patients to be treated. And the findings of a biphasic illness could impact on the pandemic in a very positive way. So I decided that I needed to put this word out, and that's when I joined LinkedIn and put all my articles there and my perspective there. Fortunately, I got invited by the Doctors Association in Malaysia to help train doctors in the perspective and how to treat. So I found an avenue there to get the information out. I also, with my work with Meghalaya, there was a Secretary of Health that contacted me for assistance. And I found in that country, they had no barriers. They were willing to look at the best treatment solutions and implement it. So from that meeting, we developed a handbook on how to actually manage COVID at home and how to treat it, how to document your 8th day, how to understand what transpires with this illness. And the information was absolutely vital in that. I also managed to get the cooperation of religious formations. I realized a while ago that mainstream media seemed to have its own agenda. I wasn't going to get this out that way. So I approached the pastors and priests and mullanas in mosques to look at this. And that's where it got traction. I felt that people were, the fear and that people had was because of the lack of information about the illness. And so I think information brought a lot of hope. People understood what needed to get done. And so I quickly realized the disconnect from the ground of seeing a patient and understanding what they need to how this gets implemented on a broader scale and how we change perspectives, how we change interventions, how we modify as we go along. So I was lucky enough to have the backing of quite a few researchers around the world and now quite a few governments around the world. It has impacted on South Africa. The government is in the process of speaking to me. So is the private practitioner associations around the country. And we're trying to look at different strategies in how we can manage this. We're going to be setting up COVID tents around the country using the perspective so that we can provide people with assistance. I think that people need good education so that you understand your illness and you understand what to do when. That helps take away the fear. I also think that from a global perspective, we need the researchers involved. We need pragmatism. We need to take away the agenda that is governed by financial gain.
Yeah,
we need some sort of organization to oversee humanity. And humanity is the patient in front of me. It doesn't come from people sitting at the top. And that's what I was invited to present on this platform. And I was attracted to the global effect that having this kind of formation could have.
Absolutely.
And so I'm proud to be associated with this.
Wonderful, wonderful. And Patricia, yourself in Bolivia, how did you get involved in Doctors for the World?
Well, thank you, Philip. In Bolivia, I'm responsible for a club food correction project. The hospital that we was running the program became COVID, and many children were left without care. Parallel to that drama, all the patients of one state that calls Beni department, there was many histories, and we can saw at the TV people dying in the streets and dying at the homes. So I was I was not working at that time in my area that was orthopedic surgeon. So we try to be together, some doctors, and we went to Beni to try to save people with chlorine dioxide. I know that chlorine dioxide, it's so controversial. Most of the reports say that it's toxic, but it's not toxic. When we went to Beni, I can tell everybody that what I saw, I was with patients in my hands and with COVID, and they don't die. We save them, and we change the history there. The people were at his homes, scared. They was running, and they was trying not to help their neighborhoods. But when they realized that with onion and with that medicine that it's so cheap, they can save people, they start to make groups in different neighborhoods. So they start to help each other, because that department that calls Beni in Bolivia doesn't have the medicine that we have in the first world. It's real poor. They are people that they even have basic like water or electricity. So the reality of many people is so different. Our reality. It's so easy to say stay at home when you have TV, when you have food, and when you have conditions. They cannot be at home when they don't have what to eat. So we start with Commons of America fighting for those people. We use Helsinki treat when in Helsinki we can, like doctors, we can use some products that maybe they consider that it's toxic, but we made a big research with 11 countries. And in that research, we can see that in the doses that we are using in our patients, there is not toxicity. We prove the non-toxicity from chlorine dioxide. So that's why we are using chlorine dioxide for prevention, not just drinking it, but in superficials too. I don't know how to say in English, I'm sorry, but we use chlorine dioxide to clean my clinic, and the clinic that when I work, we don't have COVID at all. The nurseries, the people that works with the patients, they don't. I didn't have even one case of death in my hospital, and we are making treatments with chlorine dioxide, and we are cleaning the clinic with chlorine dioxide. So that experience we produce in my whole country.
Wow.
That's my experience.
Wow. Listen, I mean,
I really I just want to say thank you to the people who helped me to do this, like Cristiani, Raúl, and Adrián Pelizari, Noel Rodriguez, all the people that we are together now. We are 11 countries that we are together in this fight. So thank you, Philip.
Well, listen, I mean, one of the things that is coming through is the passion that people have with regards to trying to make a difference with regards to COVID-19, the creativity, the innovation. What Patricia just pointed out there is that many of the strategies that we are implementing across the world don't fit for poor countries. They don't have the resources. They don't have access necessarily to the vaccines for their most vulnerable. They don't necessarily have treatments. And we need doctors to be able to think and to be able to find solutions for their patients anywhere they are in the world. And this is what I find is most remarkable about this collaboration is that we are getting countries that may not necessarily have all the resources, but are open to ideas, that are open to hearing creative solutions that will find ways out. So I think that I wanted to quickly ask Christiane, just in terms of Brazil. Brazil has been at the center of COVID for a while. Is that getting any better, or is it still a huge challenge in Brazil?
Yes, I think it's a challenge for many countries yet, but Brazil, we are leading with this. And I think it's important to say some things that is remarkable. For example, until July 90, we have some official data that I think it's important to say. We have more than 57 million cases, new cases in Brazil, but we have also more than 70 million cases of patients recovered with COVID. So I think it's very important because we just say about the numbers of the deaths or numbers of people with complication, but the number of people that get recovered is very high here in Brazil. We have also the vaccination is it's the principal strategy to fight with this pandemic. I think it's general. It's a common situation in all world today, and we have more than 140 millions of I don't know how do you say in English doses.
Yes, dosage, yes.
Doses, yeah. Okay, thank you. But we have, in the other side, many investments in researchers here in Brazil. It was created a national network that is liderated by the Ministry of Science and Technology. That it's called the Virus Network. That's joined the many specialists from Brazil, and they are launching very important researchers, mainly in developing new vaccines here in Brazil. So this is the most one of the most important things that we are doing now. And the Minister of Health, health secretaries of many parts of Brazil are in force to do all that they can do to contain this infection.
Wow.
Well, I think the most important is that we have other kind of alternatives to join the efforts to fight about the pandemic. So I think the traditional medicines and complementary medicines, how, for example, Dr. Patricia Calisperi said about chlorine dioxide and other kinds of practice that we know that's very important. I think we have to look with more detail and carefully because we can help many people in the United system, here in my country and in other countries, utilizing this kind of traditional medicines and complementary medicines.
Absolutely. And I tell you what I want us to do now, and I'm bringing Raul back because I want us to have an idea as to where you hope this will go. This is an organization that is relatively new, but the vision of what it can do is tremendous. What would you say, Raul, as to where you think this can go? You're muted at the moment, Raul.
I wonder if you would like me to share the screen or just to make it.
Yes.
Okay. So the first thing I would like to say regarding Mexico is that even though authorities are relaxing, the importance of going to meetings and to certain places where there are very crowd environments, you can see that at least as for July the 8th, there were new 9,000 new cases, and the number of dead people, of the functions, are 234,000 in Mexico. So as Dr. Cristiane was saying, the situation is not going better, even though authorities are trying to spread the word that we are much better. So Doctors for the World is an initiative that is focused to bring solutions to acute and chronic diseases on a long-term medical scope, working all together with 5 continents, and at the moment we are all volunteers. We are an innovative and disruptive organization with interdisciplinary and multi-language approach. We want to provide an interdisciplinary forum when experts can share their best medical practice, always having in mind that we need to support reliable, accessible, affordable, effective, and efficient medical treatments. We are sharing every 2 weeks meetings so that we can share these local therapeutic alternatives to the global scientific community. And faithfully, on March next year, we are going to have an annual global meetings all together with Cristiane's group in Brazil. So what has done Doctors for the World so far during these last 6 months? 6 months are 84 conferences, 31 from America, 17 from Europe, 4 from Africa, and 2 from Asia. We are willing to have conference from Oceania, and the keynote, international keynote speaker profile is 29 conferences with PhD degree, 13 with master degree, and 11 with bachelor one. As you can see in the slide, all those points, all those dots in red are the countries where we are going to have future meetings in the next 6 months.
Oh, you may not realize this, Raul, but I didn't realize you thought your screen was shared. But it doesn't matter. You captured the thought very, very clearly and all throughout. It's fine. It's fine. Don't worry. I don't think you should worry about sharing the screen. I think that you captured that vision as to what you see happening and where it should go for the future of Doctors for the World. If you put on, say, one of your main slides.
Yeah.
Mm-hmm.
I think it's that's can you see it? Yes.
Yes, we can see it. Yes.
Right. So Doctors for the World is an organization with proactive, interactive collaboration. It's disruptive, and it's respectful of local media, healthcare system decisions. We are not promoting reactive or conflictive atmospheres. We are not against the official status quo, and we do not want to be seen as breakers of regulatory current agendas, not to endorse any medical or pharma brand as such. We know that our governments, our healthcare systems have done their job, but we need that our healthcare professionals and allied professionals can share their experiences, their storytellings, and always based on evidence-based medicine. Thanks to the current situation, we have developed all this effort, these Doctors for the World weekly conferences during the first semester of 2021, and we are desiring you to join us. We are letting you know that we will not be able to do such a big task without your help. So we need your action to be part of this global medical initiative and help to build preventive healthcare options for all acute and chronic diseases worldwide. We need to attract new physicians, engage them, develop new skills, and reward them as soon as we can. We know that we have a very long healthcare roadmap. A long but productive teamwork to succeed is needed. And in the future, we expect to have, all together with Comsab Americas and the Brazil government, an approach to present our final work. That's why we are trying to do a global summit on COVID that will include clinical practical guidelines, traditionally complementary and integrative medicine, as well as impact on communities at risk. All these three pillars have been or will be conducted by Dr. Shankara Shetty, Drs. Cristiane Santos and Santos Matos, and Dr. Patricia Kalisperis, as well as Lulu Oguda from Kenya and Martin Kulder from the United States, from Harvard University. We hope you can join us. We need to stress the importance of good management skills, preventive primary care, research, and educational resources.
Yeah.
Join us, become part of this family, volunteer with your knowledge, with your advice, and let us be sustainable. We need your support so that we, even though we have different cultures, we need one voice and one line of action.
And this is an important point, Raul, with regards to if somebody is watching this and they are not a physician or a clinician, are you still inviting them to join, or is this exclusive to clinicians?
No, it's open to everyone that is a life professional, and even lawyers and people that can help, such as interpreters in different languages with different skills. We need everyone to join us.
Yeah. Wonderful, wonderful. I'm going to be closing out and just trying to get some final thoughts from people. And if you don't mind, I'll start with Patricia. Patricia, in terms of where you think this is going to go with regards to COVID-19, do you think that we are beyond it?
Well, Philip, what I think is that just together we can change some things, especially the fear, because I think we can changing the fear and be together, each of us in our position. I think we can make the difference.
Wonderful, wonderful. And Shankara, any thoughts as to where you think things are going to be going forward for the world?
Philip, I think that this pandemic will fizzle out. We're seeing herd immunity here and there. The vaccines are making some progress. So I think corona is going to become an endemic disease. I think what Patricia said is absolutely true. We have too much of fear around the world. And generally, when people are too fearful, we make rash decisions. So I think we need to bring some hope and bring some understanding to this pandemic on a global scale to take away that fear and give people some hope. We need to go back to our lives. And I think we need to show the light at the end of this tunnel. So I think there's always hope.
Yes, wonderful. And Christiane, any thoughts as to where you see things going in the next few months or a year with COVID?
I think in a place like Brazil, that is so complex scenario and so big geographically, I think it's a little difficult to oversee something. But I think that we are having and getting many effort here in Brazil, many doctors, scientific researchers, in order um to get more answers about what we are living now. So I think we are working in one thing that I think it's very important now, that is actions regarding to health promotion.
Hmm.
I think
Yes,
it's
wonderful. Wonderful. And Rodrigo, any thoughts? I'm going to ask you to translate for Fanny at the end. So I'll mhm.
Sure, Philip. As I think all my colleagues have circled around what in our views should be the future of this pandemic. We mentioned various items: eliminating fear, working together, applying research, and I think it's all about the principles. I think the pandemic pushed us to do uncoordinated efforts. Uncoordinated efforts to save lives. But I think, with the participation of different minds around the world, we need to get back to the path of organization, of science, of data, of results, and we need to put those results and that research to work. That, excellent, I think, should be the focus.
Wonderful. And if you could explain for Fanny, I'd like us to close out with Fanny being almost the inspiration for where we are today, what her vision would be for Doctors for the World going forward.
Doctors for the World has to grow globally and in each country. We ask that people join, that add their time to the effort, their knowledge, and their guidance. It has to be an organization that spreads. This is only something that we can accomplish with the help of everyone. You need your help to make this happen. Because today, we're here and we don't know if we'll be here tomorrow, but Doctors for the World will go to each and every country, communicating ourselves as a family. And Doctors for the World is a family.
Wonderful, wonderful. Beautiful, beautiful thoughts. It's a privilege to speak to all of you today, to hear these ideas, to see this vision, and it feels like such an inspiration to be part of this journey. So, I mean, I know that many people will be interested to find out more. There's still a lot of work that needs to be done in the background for Doctors for the World, building their website, setting everything up. I'm going to be putting a link on my page with Macmillan Research so that anybody who wants to come into the next Zoom meeting, which will be next Sunday, will be able to see it. So that will be in the description afterwards, and they will be building on LinkedIn a page so that that information can be passed out and just gradually build and grow what appears to be one of the most remarkable things to come out of this pandemic. So really appreciate everyone here today. Thank you all so much for taking the time to share your knowledge and your experience. And I'm sure we're going to be speaking with you all again. Have a wonderful evening, everyone.
Thank you.
Thank you very much. Thank you.